A very good day to all of you, my dear colleagues. On behalf of the MEU team and the curriculum committee team members, I'm presenting this small instructional video for each one of you to help you in the planning and implementation of the timetable for the 2020-21 batch. So the CBME was introduced by MCI last year, and they had the following timetable. You see, they started somewhere in August with the foundation course, August of 2019, and I'm sure each one of you would have been a part of that foundation course where a student sort of gets adjusted to the MBBS course. It started in September then, the regular teaching program, and we are over here till March. Everything was going fine. Then the COVID hit, and now their online classes are going on, but we expect them to have the exam conducted in September 2020, where they will finish their first MBBS exam and they will go into phase 2. So right now, first MBBS is called phase 1, second MBBS is called phase 2, third MBBS is divided into two parts, phase 3 part 1 and phase 3 part 2. Okay, so the students are right now, the 2019 students are right now in phase 1, and they are near approaching their exams. Well, the first year faculty did an excellent job of making a timetable, not for a week, not for a month, but they were supposed to make the timetable for 52 weeks all at one time. And this is just a snapshot of that timetable. For week 2, we can see how on Monday the various lectures that are being taken, like for example from 8:30 to 9:30, they have one competency. This is BI, stands for biochemistry, the number 5.1, and the topic, that is amino acid and protein chemistry, and L stands for the teaching learning method, that is a lecture. The class would be taught by a lecture. Okay, and similarly you get to see the physiology class from 9:30 to 10:30. And then from 10:30 to 11:30 you get to see another physiology class with another competency that is taken, and from 11:30 to 1:15 we have a dissection. After the lunch break, they have been divided into 4 batches, A, B, C, D, and we get to see on a particular day, at a particular time of the year, what will be the competencies covered by the teacher for a student. So basically this timetable had to be done for the entire 52 weeks, which is easily available from the website of our medical college under the heading CBME. And the entire thing was planned for 52 weeks. It was a tedious job, but it was done. Now, the next thing that comes is they will be coming into the second professional or phase 2. And over there are various specialities that will be teaching them competencies according to their departments, like pathology, microbiology, pharmac, forensic medicine, toxicology. You have introduction to clinical subjects, including community medicine, and you have the ATCOM, that is attitude and communication. But the main thing that I want to focus on right now is the clinical postings. Okay, so among the clinical postings, now these are the differentiation or the hours allocated for the various specialities. And for my clinicians, I just want you to focus on this thing that is marked in orange. Okay, so for the clinical postings, we have been allotted 540 hours, and this 75 hours represents theory classes. These 75 hours will be distributed only among the 3 departments, that is Ops and Gynac, General Medicine and General Surgery. 25 hours for each department, while the 540 hours that is in the clinical posting is actually 36 weeks. Now, the clinical postings will be only for 5 days a week, 3 hours per day. That is from Monday to Friday, from 8:30 to 11:30 will the clinical postings be held. Okay, and among them, we have sort of split it up to make it easier for you to understand. Dr. Apuka, who will be managing the rest of the departments in phase 2, has sort of given us a general guideline where we would have to plan for this clinical posting, that is from 8:30 to 11:30, a 3-hour period for the respective time that the student has been allocated to us. For example, Gynac, community medicine, medicine, general medicine and surgery, the students will be with us for 4 weeks. So the Department of Medicine would have to make a 4-week timetable day by day with the competencies. Now in the next we get to see ophthalm, ENT, which have 4 weeks each, and then pediatrics and orthopedics have 2 weeks each, so a total of 12 weeks over here. And then the student will do 2 weeks posting in each of these specialties, that is psychiatry, dermatology, respiratory medicine and clinical pathology. That becomes a total of 8 weeks. So a total is 36 weeks the student will be with clinical postings. So where is our work come over here? Yes, we would have to make the timetable with the competencies. Have you to make the competencies? No. The competencies are already made by the MCI. So part of our job is actually being done. Now, where will we get these competencies? Yes, these competencies are available with certain resources that I will be giving to each one of you. Now, for sake of convenience, we will be even providing templates. Okay. For example, over here, I've given a template for the Ops and Gynac department, or we can apply this template to any other department, where I have divided it from Monday to Friday, and I have marked spaces in which you will put the competencies in between. That is, each department will have to place their competencies according to priority, that is according to what they feel is most important for them, for a student to learn at that particular time of their learning phase. Okay, so where will we get these competencies? These competencies will be got from a curriculum book, the UG curriculum book that has been given to us by the MCI. It is easily available at the MCI website. I will also forward it to you on the group that I have made, okay, for all the HODs. Now there are 3 volumes. You need to see which volume you need to refer to, because volume 1 will have the community medicine, general medicine, respiratory medicine, pediatrics, psychiatry, dermatology. Okay, while volume 3 will have all the surgical branches like general surgery, ophthalmology, ENT, Ops and Gynac, orthopedics, anesthesiology, radiodiagnosis, radiotherapy, dentistry. Okay, so look where your subject is, and then you need to go to the competencies at that particular page. Now the competencies are many competencies are given. For example, I've just taken a small example that I want to demonstrate to you. This is a competency that is taken from Ops and Gynac. Okay, so ONG stands for Ops and Gynac. So different subjects will have different code, and after ONG will come a number. Like for example, the one that I have marked in orange is 8.2. Now, for example, Ops and Gynac might have 100 competencies that we would have to teach the students. In the core competency, whether a competency is a core, yes or no, where Y is marked, it stands for yes. All the core competencies have to be taught to the students. So you take a competency, you look at the competency, which domain does it belong to. So see that it usually belongs to the show house. That means show house represents a competency that belongs to some skill which has to be taught to the students. For example, take this competency. This box represents the competency. For example, elicit, document and present an obstetrical history including menstrual history, last menstrual period, previous obstetrical history, comorbid conditions, past medical history and surgical history. This is a skill. Now this skill has to be taught during the clinical postings. So when you're choosing competencies, be careful that you choose the competencies that are specific to some skill or some knowledge that has to be taught only in the clinical posting. I'm sure all of you are already doing these things, but now we just need to document it with the competency and the competency number in the timetable that has been provided to you. Okay, so any help that is required will be provided. All the resource material will be given to you on the WhatsApp. If you want it on the email, please give me your email IDs and I will also send it on the email. If you require special help, yes, please call us and we will fix an appointment where we will actually clear your doubts for each one of you. We have a deadline over here. The MCI has given us a deadline of 15th of August, but you see I've put it over there as 10th of August simply because each one of the departments will be giving us the raw data. After that, we would have to integrate all that data together, which is quite a huge job. After integrating the data from the MCI, they will give us a checklist where we would have to modify the raw data or align and integrate the various competencies so that the student has a proper learning experience. All that takes a long time. So I've given 5 days for us to do that. So till by the 10th of August, if you could give us this raw data, it would be of great help. I'm sure this is a very difficult task, especially because it is a different task. It is a change. But I'm sure, with every difficulty also comes an opportunity to learn, to become better, to become more effective for our students. So I just wish you happy learning in this experience. I also want to tell the HODs that if there is anybody who thinks that they are not able to do it and they want to delegate the job to somebody, please go ahead and delegate. Just let us know who you're delegating the job to so that we can include that person too in the group and communicate with them. Thank you.